Classifications of 4 CTDs: Sjogren's, ACTD, UCTD. Number 1, Sjogren's syndrome. Imagine a patient who always carries a water bottle, yet still struggles with a dry mouth. Pause 2 sec. Their eyes feel gritty and burning, and eye drops are their constant companion. This is the world of Sjogren's syndrome. In Sjogren's, the immune system mistakenly attacks the salivary and tear glands. The result? Severe dryness, what doctors call sicca symptoms. The mouth dryness causes repeated cavities, oral infections, and difficulty swallowing. Eye dryness can even progress to corneal ulcers, which threaten vision. But Sjogren's is not limited to dryness. It can affect nerves, blood vessels, and internal organs. Importantly, it carries a higher risk of lymphoma. Example vignette. A 45-year-old woman keeps visiting her dentist for repeated cavities. Later, when she also reports burning eyes, she's diagnosed with Sjogren's syndrome. This shows us how simple dental or eye issues may hide a serious autoimmune disease. Number 2, antiphospholipid syndrome, APS. Now imagine a young woman just 28 years old who has already suffered 2 miscarriages. Later, she develops sudden leg swelling and pain, a blood clot. Testing reveals antiphospholipid syndrome. APS is a condition where the body produces antibodies that make blood more likely to clot. Pause 2 sec. It can affect veins, causing deep vein thrombosis or pulmonary embolism, and arteries, leading to stroke or heart attack. In pregnancy, it causes miscarriages, preeclampsia, and poor fetal growth. The most feared type is catastrophic APS, where clots form all over the body within days, leading to multi-organ failure. Though rare, it is life-threatening. Example vignette. Think of a woman in her 30s who has 3 pregnancy losses despite being otherwise healthy. Later, she suddenly develops a stroke. Tests show antiphospholipid antibodies. The APS diagnosis finally connects her miscarriages and stroke risk into one explanation. Number 3, mixed connective tissue disease, MCTD. MCTD is like a puzzle. It borrows pieces from multiple CTDs. A patient may have the rash of lupus, the tight skin of scleroderma, and the muscle weakness of polymyositis, all in one person. The hallmark of MCTD is the presence of anti-RNP antibodies. These antibodies help doctors separate it from other autoimmune diseases. The most serious complications are pulmonary hypertension and interstitial lung disease, which often determine long-term survival. Example vignette. A 32-year-old office worker develops puffy hands, making typing difficult. Later, she feels breathless from lung involvement and also has arthritis. A blood test shows anti-RNP positivity, confirming MCTD. This case shows how overlapping symptoms gradually reveal the bigger autoimmune picture. Number 4, undifferentiated connective tissue disease, UCTD. Finally, let's look at UCTD. Think of it as the waiting room of CTDs. These are patients who show autoimmune features but don't fit neatly into lupus, scleroderma, or RA. Common symptoms include joint pain, Raynaud's phenomenon, mild rashes, or positive ANA tests. But the full criteria for a specific CTD aren't met. Some patients remain UCTD for years without progression, while others eventually evolve into a defined CTD. Pause 2 sec. That's why careful follow-up and monitoring are essential. Example vignette. A 26-year-old student complains of fatigue, joint stiffness, and has a positive ANA test. She doesn't meet lupus criteria yet. Over the next few years, she stays stable, a case of UCTD. But in another patient, the same early symptoms may slowly evolve into lupus or RA. Dr.Yogesh summarizes number 1, Sjogren's syndrome shows how disabling dryness can be. Number 2, APS highlights the danger of blood clots and pregnancy loss. Number 3, MCTD demonstrates the overlap and complexity of autoimmune disease. And number 4, UCTD teaches us that not all patients fit into boxes, but they still need follow-up. Together, these 4 CTDs complete the spectrum beyond lupus, scleroderma, dermatomyositis, and RA, reminding us why vigilance is key in rheumatology and dermatology.